Good morning. This is Amy Rowling McGee, the president of the Health Policy Institute of Ohio. I'm joined here at HPIO's offices by Amy Bush-Stevens, also from HPIO, and Laura Rooney from the Ohio Department of Health. In case you missed my announcement a little bit earlier, if you are joining by phone, please remember to enter your audio PIN number, which is on the right side of your screen. You will have needed to have entered that in order to participate in discussion a little later. Thank you for joining us today. We know that for local health departments and hospitals in particular, this is an extraordinarily busy time as you both prepare and respond to concerns related to COVID-19. This will be a relatively brief meeting because we want to honor the time you're committing to other obligations at this moment. Before we get started, I have just a few housekeeping items. This slide deck and a recording of this webinar will be posted on the HPIO SHA-SHIP webpage. Also, especially given that people are working on COVID-19, we want to make sure that people do have an opportunity to provide feedback even apart from this webinar, and we'll discuss that in more detail throughout the webinar this morning. For now, everyone is in listen-only mode. We want this to be an interactive meeting, so if you have a question while we're still in listen-only mode, please type it into the question box and we will periodically pause to respond to questions. As I mentioned, there will be opportunities for discussion later in the webinar. During the discussion, please raise your virtual hand, which is in the upper right hand of your screen, and we'll unmute you. Keep in mind, if you've muted yourself, you'll need to unmute your own audio as well. Again, please make sure if you joined by phone that you've entered your audio PIN. You'll need to log into the webinar first before calling in order to get your PIN. This is our agenda for the call today. We look forward to this next step in the State Health Improvement Plan process. We're going to be reviewing the draft basic guidance for local health departments and hospitals today. As we get started, we have a quick poll question that we'd like to take to know who we have on the phone. So the question is, which sector do you represent? Local health departments, hospitals, the Ohio Department of Health, or other? So please take a moment to respond to this poll question so that we know who is here. We wanted to note that we did make sure that the list of invitees for the meeting was an even mix of local health departments and hospitals. All right, thank you. Thank you for responding to the poll question. You can see we are indeed even in terms of local health department and hospital representation on the call. And we have 12% other. So that's interesting. All right, well, with that, I'm going to turn the microphone over to Laura Rooney with the Ohio Department of Health.
Good morning, everyone, and thank you for joining this call. I wanted to, as I'm starting, if you want to take note of my contact information, please do so. I am the Ohio Department of Health's new Health Improvement Planner. This is a new position for ODH. My role is to really help facilitate and monitor the implementation of the SHIP. I'm working with HPIO and others in our steering committee, the advisory committees. I'll be working with our state agency partners, along with some of you at the local health departments and our other programmatic areas across ODH, and really to help look at alignment And so I have been with the Ohio Department of Health for just over 10 years. Most of my time has been in the Bureau of Maternal and Child and Family Health. I've specifically been in the role of Adolescent Health Program Manager. I was the interim Title V Maternal and Child Health Block Grant Manager, and have been part of the SHAW and SHIP in the previous development as well as throughout this cycle. So again, I encourage you to save my contact. Be more than happy to talk with you through phone or through email about the SHAW and SHIP as we move forward through our release and our implementation phases. So again, thank you for taking your time and in really providing all the work that you do in dedication and providing feedback and expertise towards the development of the SHAW and the SHIP. Your assistance in reviewing the guidance is very much appreciated and will really assist the other fellow health departments and hospitals as they're working with the SHIP. The content, as some of you know, was developed as a result of feedback provided during the regional state health assessment meetings, surveys, and ongoing discussions as well. Feedback and feasibility and ease of use has been heavily considered during the development of the guidance document. And then moving forward, if you look at these other tabs of working with the governor's office. So we are working to get the state health improvement plan out as quickly as possible. We are aware of the urgency regarding aligning the CHIPs with the SHIP in order to meet the deadline for submitting aligned plans in October of this year. We are developing specific directions for this alignment and how to submit the plans. These are currently being developed and will take into account that the SHIP has not yet been released and that time and attention has been diverted to COVID-19 response. Under consideration are both what will be required to submit and how it will be submitted. We realize that feasibility and ease are of utmost importance, and we may call upon you to provide additional feedback as our plans are being developed. So again, we thank you for your time, your patience, and your dedication to this effort. And please feel free to contact me as we go through this process. So looking ahead, I want to share with you what our Office of Performance and Innovation is doing to support the SHAW and the SHIP in the future. And more information will be made available for each of these items that's listed on the slide in the coming weeks and months, but I wanted to alert you to what's ahead. So first, ODH has created my position as planner. There will be a second position that will provide technical assistance at the local level and support performance measurement. We are currently seeking candidates. That position will be reposted in the future. Just so you know what we're looking for, we're preferably looking for someone with local experience and a deep understanding of planning and performance measurement, and training experience is also preferred. Moving forward, ODH will be developing interagency agreements with other state agencies to support alignment of their work to the SHIP. This will assist in leveraging resources and impacting community conditions, as well as strengthening our partnerships at the state and local level, all with that goal of alignment and leveraging resources. We will continue to work with HPIO and ask for your help as we are developing resources such as this guidance document as we're doing today. There will be a toolkit developed and an equity action guide. There will be more to come on those two in the future. And then training for users and consultants and those who work with the users. We will be providing additional training that will be made available to those that support local health departments in the development and working with end users. Considering our website, we really want to enhance the website so that it's more of an interactive SHIP web page. And then you see innovation projects. We are really excited about our upcoming innovation projects. More details about this will be made available very soon. But this project will provide funds for developing innovative solutions to complex problems. This will involve training, project development, implementation, and evaluation of an outcome, and funding will be made available to support this effort in terms of planning and implementation phases. For performance management, ODH will be using the Clear Impact platform to support the evaluation of the SHIP implementation. We know that many of the local health departments have received licenses for this, and we will continue to support the health departments and our ODH staff on developing scorecards. And through that, we will provide details as they are made available. We know that through the advisory committee, there will still be more interaction with you, so you will be able to hear more about this as we move forward. So again, I want to just thank you for your continued support. We will work through the feedback that you get from any guidance information, and if you do have after we go through this alignment possibilities through guidance, if you have specific feedback on the alignment related to the Ohio Revised Code, please feel free to email me and we will take those comments into consideration. So again, thank you very much. And I'm going to turn this over to Amy Bush-Stevens.
Good morning, everyone. This is Amy Bush-Stevens at HPIO, and we are delighted to have such a good number of folks on the call today, given everything that that is going on. So thank you for being here. I'm going to start with an overview of some work that we are doing with the Department of Health, and then we'll dig into the details on the basic guidance. Ohio Department of Health has contracted with HPIO to develop a series of SHIP supplemental materials. And we'll take a quick look at those. First, we have a 2-page executive summary for the State Health Improvement Plan, which is intended for a broad audience. Then there is the full SHIP document, and that digs into all the details related to objectives and strategies. Then we have the basic guidance, and this document has a very specific audience and purpose. And you all on the call today are the audience for this document because it's for local health departments and hospitals. And you should have received a PDF of this draft document as an attachment from me last week. It is also posted as a handout in the GoToWebinar window. So if you don't have it from the email, you can also pull it from the handout tab at the top right of your screen. We will also be developing a toolkit to provide more detailed information about how to implement each aspect of the SHIP, including equity, priorities, objectives, and strategies. Finally, we'll be developing some cross-sector promotional materials, things like fact sheets, and we're going to start with a focus on housing and education partners. We'll create some pieces that are designed for housing and education organizations, as well as some materials for health partners that are reaching out to those sectors. Now we want to get your feedback on the basic guidance. You may recall the guidance that ODH issued along with the previous SHIP. So this blue document on the left was released in early 2017, and that went along with the 2017-2019 State Health Improvement Plan. And what we're looking at today is an updated version to go along with the 2020-22 SHIP. Here are the objectives for this guidance. And I am going to review these, go over this slide here to make sure we're all clear on the objectives for this document. So as a result of reading this document, local health departments and hospital staff will understand the provisions and purpose of the Ohio Revised code 3701. So this is a section of the code that is relevant to assessments and plans. And we'll know how to comply with these requirements regarding transparency, accessibility, and timeline. Be aware of expectations regarding local collaboration for SHIP implementation. Be aware of how to align with the 2020-2022 State Health Improvement Plan in terms of priority indicator, priority population strategy alignment in your own CHIPS and implementation strategies. And then in addition, for hospitals, knowing how to comply with the Schedule H community benefit reporting requirements. So those are the objectives for this draft document. And now I'm going to shift over to pull up the PDF document, and we're actually going to walk through some of the pages in that draft. And first, I need to share my screen. So bear with us a moment as we pull up that PDF to show on the screen, or you can also pull it up from your handout tab or from the email that I sent last week. And a reminder as we go through that you can raise your hand if you want to speak. There's a little hand button to the top right of your screen, and you can click that if you would like to speak to the group, or you can submit comments using the question box, and then we can read those to the group or have those on hand. Everyone should now be able to see the document here. Make it a little bit smaller. Okay. So the question that I want everyone to be thinking about as we walk through this document is, given the objectives, so those objectives for the document that we just looked at, what suggestions do you have to improve the following aspects of the document? Clarity and messaging, content, and formatting. So as we go through, be thinking about those three things: clarity and messaging, content, and formatting. And as you give feedback via raising your hand or the question box. Okay, so I'm going to take us to first page here. All right. I want to call your attention to the box at the top right where it says purpose of this document, and then to the bottom where we have this red box that talks about hospitals and local health departments. So is there any feedback that anyone would like to offer related to clarity and messaging, content, or formatting on this page and in those areas in particular? Okay. Do we have a raised hand? No. Okay. I'm going to keep rolling through the document here, but as you think of anything, you can, on any pages, you can put it in the question box or raise your hand. It's not related to the, yeah. Okay, the next page here is the framework for the SHIP, and we're actually not going to focus specifically on that today. So I'm going to take us to this next page. This is where we walk through the requirements for hospitals and local health departments, both from the national perspective, so from the IRS, and then also the FAB accreditation prerequisites. And then on the right-hand side, we have the Ohio requirements that are in that provision of the Ohio Revised Code. So just a summary of those requirements, and then some links to additional resources. So I'll pause here again for a moment. We're looking for feedback on clarity, content, and formatting. Hopefully this is a clear summary of information that is available from different sources. We're just kind of putting it together in one place. Okay, not seeing any hands or any comments. I'm gonna move us along to the next page. Here's where we get into more specifically the components of the 2020-2022 State Health Improvement Plan and talk about how locals can align with those components. So the first piece is priorities. And the alignment is to identify at least one priority factor and at least one priority health outcome with a strong recommendation to include community conditions. And when we get to the next page to figure 3, we can look at that a little more closely, as well as the alignment on indicators which flow from the priorities. Then for strategies, the alignment is to select at least one strategy for each selected priority. And then for equity, to, whenever possible, identify priority populations for objectives and select strategies likely to reduce disparities and inequities. And there will be more detail on how to do that in the toolkit. So that is the general kind of overview of alignment. And then it refers to this table here that shows how you can pick from this menu of the priority factors. So selecting one of those, selecting community conditions or health behaviors or access to care, selecting at least one, and then same thing for the green, mental health and addiction, chronic disease, and maternal and infant health. And it looks like we have a hand raised from Marianne. We are going to unmute you. So go ahead.
Hi, good morning to all. I wanted to also share with the other attendees about my comment related to the alignment timing. I have communicated with Amy, Joan Purcell, as well as Laura Rooney with regards to the difficulty by which hospitals would experience related to which state health improvement plan 3-tier period to align with. Considering the fact that we have completed and have our board approved all our CHAs and implementation strategies, and we have specifically indicated alignment with the 17 to 19 state health improvement plan. So I would like to suggest that particular paragraph be reviewed by the team as well as by the attendees.
Okay, Laura, do you want to say?
So Marianne, this is Laura. We really appreciate your feedback and comments to that and reaching out to Amy, Joanne, and myself. So we are taking that into consideration, and we are encouraging folks to look at their 17 and 19 plan, looking at how we have the selection of priority factors and priority health outcomes, that it's picking one of each, looking at the indicators, and going back to the 17 and 19 plan to see if there is alignment there existing. If there is, that's great. You are in good shape. And for those that are not, that's why we're really looking at these considerations of this Ohio Revised Code. So and how we can look at the feasibility and timing, etc., and what will need to be submitted and the platform in which that will be submitted. So thank you for your comment, and for those of you that have other comments beyond what Marianne has suggested, please feel free to email me, and we will provide feedback and take that into consideration. So thank you very much.
Thanks, Laura. It looks like we have another hand raised, Danielle Price. And so we are going to unmute you, Danielle. Go ahead.
Hi, everybody. I had the exact same comment, but I also want to know if you can just speak a little bit to the difference between what's required and what is guidance related to the alignment pieces.
So this is Laura again. The requirement is really about the alignment, and then ODH is to provide guidance as to how that alignment will be completed. And so that's why we are creating this document, to help provide instruction for that alignment, and why we're here today, to get your feedback into feasibility. And so that's what we're looking at. In terms of submission, that's what we're trying and showing how you are aligning. That's what we're considering. How do we best do that to meet the timing and the priorities and demands that are taking place right now.
Okay, thank you, Danielle, and thank you, Laura. I don't think we have any other hands raised at the moment. So those were both comments regarding the timing of the alignment. And just want to pause here for a moment just to see if there's any comments about the clarity of this section. So this kind of menu to select from. So kind of regardless of when the timing is, looking at the usefulness of this menu format. This is the second page of that. Okay. And then on this page, in the top right is a link to the ODH page where assessments and plans and community benefit information is currently posted. ODH is going to be revamping the website, and so these links are not final at this point, but that information will be updated on the ODH website in the future. Then we have a section here that talks about joint versus individual plans. And this is a little bit of a sticky wicket, or a little bit tricky to explain. So we just wanted to check in on the clarity of this section. Any comments on the clarity of this section? This is speaking to the fact that in some communities, the local health department, the hospital or hospitals get together and have a single assessment document that names all of those entities as the leaders and kind of holders of that assessment document. Sometimes they might do the same thing for the plan. And so if you go to the websites of each of those local health departments and hospitals, you would find the same document. In other cases, there was collaboration that happened, but each entity might have their own document, or they might have part of the document be the same and part of it be specific to their entity. So there are a variety of different ways that collaboration can be expressed in document form, and we just wanted to convey here an understanding that will vary somewhat by community, but alignment and collaboration should always be the goal. However that needs to look locally. So that's what that section is about, and then kind of similarly a discussion about county versus regional plans. Again, recognizing that there are different conditions, different configurations in different communities. Okay, we've got a comment here from Brandon. For the second bullet point, do you want each individual plan to align solely with the SHIP, or do they need to show alignment between the plans of the community as well as the SHIP? So I'm going to scroll back up here. I think we're, whoops. All right, I'm not having good PDF control here. Okay, so I assume this is about this joint assessment and aligned individual plan. And the question is about should that be aligned to the SHIP or aligned to the community? In an ideal situation, the community plan would be aligned to the SHIP. And so everything would be aligned to the SHIP. And again, looking at the SHIP as a menu, so that may mean that there's one priority factor and one priority outcome that align with the SHIP, and maybe other ones that are different, but that there is some connective thread of alignment to the SHIP in both. I hope I've answered your question, Brandon. And also, just to note that the health outcome priority areas, so the mental health and addiction, chronic disease, and maternal and infant health, those are the same as were in the 2017-2019 SHIP. The health factors are newly added for the 2020-2022 SHIP. However, the strategies that are found in the previous SHIP and the more recent SHIP, there's a great deal of overlap in those strategies. And so you will not necessarily see a lot of difference in the strategies. There is another section here that talks about kind of going forward what ODH will be doing to provide support and evaluation for the SHIP. And there will be an email account set up to handle directly any questions and technical assistance related to the SHIP. In the appendix, we plan to list the members of this committee. And then we also have the SHIP implementation timeline, which, let's see, where's the rotation? Okay, that we discussed. All right, so I'm going to pause again for a minute here to see if there are any additional suggestions to strengthen this document or questions about anything that's in this document. And again, focusing on clarity, content, and formatting. And you can raise your hand. Oh, we do have a hand raised. Danielle Price, go ahead, Danielle.
Hi, I have another question actually. I want to make sure I'm understanding correctly that the indicators that you have listed, for example, in the step 2 area for community conditions, are we to just pull from these? Is that what the recommendation is, or can we pick other things. I know that we can, but are you suggesting that this be the, is that what you're intending with this? This is not like a sample of things. You actually want us to prioritize these.
Yeah, so these are the, so if you take a look at those desired outcomes listed on the left and then the indicators on the right, those are the outcomes and the indicators that were prioritized during the SHIP development process. So this is the complete list of priority factors and indicators that are included in the SHIP. So this is the menu to select from. Of course, we understand that many local communities will have additional additional outcomes and indicators that might be related to these or might be completely different, but and it also may depend somewhat on local data availability and also local partnerships, momentum, you know, things that are happening in your community that may be different.
Thank you.
Yep. Good question. Thank you for clarifying that. Okay, we have another comment here from Brandon. When you release the digital version, I'd have the framework and timeline rotated for readability. Okay, got it. Yes. I think we can do that. And then we have another hand raised here. Kathleen Cowan, go ahead.
Hi, this is Kathy Cowan in Columbus. I had a question about the wording in the ORC, and I'm wondering if there's any guidance, I guess, on that. So for the Board of Health, they're supposed to conduct an assessment and create a community health improvement plan. So does that, so for areas like ours that have 2 boards of health, just the role that the health department needs to play in terms of like making their own assessment and plan versus participating in one.
So as your question is kind of getting at the joint versus individual issue?
Yes. Yes.
Yeah, so there certainly have been local health departments that do a joint document. So it's the same document with both entities named on that document. And then in other cases, it's 2 separate documents, but there was some level of coordination. So that's really up to the local community, whether you're going to have one joint document or 2 separate aligned connected in some way documents. So there's nothing meant to be specific in this guidance that would say you have to do it one way or the other. And I think the language in the ORC would allow for either approach. Does that help?
Yes, it does. Thank you.
Okay, great. Okay, I don't think we have any other hands raised at this moment. But we do have another hand raised. Brandon, go ahead.
Hello?
You are unmuted, Brandon. Go ahead.
Oh, I was muted on my end too, so that didn't work out.
Okay.
Okay, my question is back in that joint and individual plan, because Kathy was just talking about that.
Yeah.
In the 3rd bullet, you mentioned individual assessments and individual plans for each hospital and health department with coordination and alignment. In the paragraph below that, under county and regional plans, you state that collaboration should occur at the county level at minimum, and that everybody should basically work together on assessments plans to ensure that there's that coordination. I wonder if that 3rd bullet point might give the impression that, and maybe some counties do this, I don't know, where every organization is doing their own assessment and then developing their own plans from it, but I would think that would have everybody working off slightly different information or incomplete information. I might be nitpicking this too, that's a possibility?
Yeah, so the question is kind of, does the third bullet conflict with the idea of having planning at least at the county level? Is that
Yes.
okay? That's unclear. Yeah, I think we will work on clarifying that wording to make that more clear, because I can see how you could interpret that as being conflicting. I think the spirit of what's here is that having planning at least at the county level. So if there are multiple local health departments in a county or multiple hospitals in a county, that there is coordination at least at the county level. However, recognizing that there's unique situations in some communities. So we will take a closer look at that and make
Okay, because I can just imagine
yeah.
too, if any health department was using this for reaccreditation, and you would say that, oh, we all did our own individual plans. Well, I know FAB would not take a kind eye to everybody working in silos. So, but just my 2 cents.
Yeah, thank you very much. That's definitely a tricky area. Okay, I am not seeing any other questions in the question box. So I'm going to pull us back over to our slides. I am going to be sending out an email later today to everyone who's on this group, including those who were not able to participate today, letting them know that they can provide email. And certainly anyone on the call today is also welcome to, if you think of something else or you just needed a little more time to dig into this and think about a suggested revision, you can send that to me by email, preferably by Friday. We will be posting this, the recording of this webinar and the slides on the ShawShip page. I'll show you where that is in just a minute. And so, you know, if you want to review the webinar or have someone else from your organization review it, that is totally fine. Okay. Move us along here. I was supposed to show you these slides before. I did not. Okay. All right, so I want to talk a minute here about next steps in this process. We will be convening the full advisory committee for the State Health Improvement Plan later on this spring. We are planning to have 2 meetings via webinar to get your feedback on the SHIP toolkit and on those multi-sector promotional materials that I mentioned. And all of the information about those advisory committee meetings will be posted here on the HPIO ShawShip page. So if you just go to HPIO and search under groups for ShawShip Advisory Committee, you will find your way to this page. This is also where the recording from the webinar will be posted. And we have another poll question for you. And this will sort of help us as we're working on the toolkit. How does your organization plan to use the 2020-2022 State Health Improvement Plan? So please go ahead and vote. Are you planning to use it to align or frame priorities, existing priorities, or to set new priorities, develop measurable objectives or an outcome evaluation, to focus more on equity, to find evidence-based strategies, or to expand the scope to include community conditions? And I see we've given you very confusing instructions. We say choose all that apply and select one. Do you know which it'll allow, Alana? Is it just one? Okay, so you have to pick your favorite. We know you may be doing more of these things, but pick the one that you're most excited about. We'll give you a minute here. Okay, let's take a look at those results. Okay, so the biggest one was align or frame existing priorities or set new priorities. And then also for finding evidence-based strategies and somewhat for a focus on equity. Wonderful. So the toolkit will address all of these topics, and we look forward to getting your input on that within the next few months. Move us to the next slide. Okay. So before we go, we have one more discussion question, which is what considerations should we keep in mind as we develop the SHIP toolkit to ensure that it's useful to local health departments and hospitals? So what would be most useful to you as we put that toolkit together? Is there anything in particular that you really wish you had? Maybe thinking back to aligning to the previous SHIP, anything that was unclear or you just felt you needed a little more detail on. And again, you can raise your hand or you can use the question box. Okay, we have a suggestion here in the question box from Jan Ruma. Let me just make sure I can see the whole thing. Okay, could you add specific examples on how counties can align their assessments and health improvement plans with the state based on what year they perform their assessment and plan, i.e. health assessment released in 2020, health assessment 2021, and what did they submit by the October 2020 deadline? Thank you for that suggestion, Jan. I don't think we had thought of that specifically for the toolkit, and so that is definitely something that we can pull together. Okay, a comment from Jessica, maybe giving some specific examples of how hospitals and health departments are aligning, like a short case study. Okay, so some real life examples of things that are already happening. We know there are things happening. Okay, I don't think we have any hands raised. Any other suggestions? Okay, and Laura is gonna say a few closing words.
Hi, everyone. I just want to thank you for your comments and your questions. They were great. We will definitely be taking these into consideration. We recognize that some of the timing and things, they create challenges, and we just appreciate the feedback from you at the local level as to how we can prepare the best guidance for you as well as the other local health departments and hospitals. So thank you so much. And as Amy said, if you think of other things after you hang up or your colleagues, please feel free to send those. If it's about the document itself, send that to Amy Bush-Stevens. If it's about that alignment and Ohio Revised Code type questions, please feel free to email me, and ODH will be taking that into consideration. And I think that Amy said that there's one more comment or question, so I'll turn that back over to her.
Yeah, we have a question in the question box from Jan Ruma. How will clear impact be available to local community agencies? And I'm going to turn that one back over to.
At this time, the Ohio Department of Health has a contract with Clear Impact, and many of the local health departments have a license with Clear Impact that will be used to look at performance measurement. So we're getting down into, right now you see the indicators that are population based outcomes. Clear Impact is looking at the performance of the strategies And so what was done and what is our trend, and meeting our performance measures for those. So the local health departments will have, those that have that license will be able to use that to create scorecards to help with some of those performance measures. And so as that platform grows and we become more familiar with it, we will look into additional options. But right now, that's where there we are. So thank you for asking that clarifying question as to how that's used.
Great, thank you, Laura. And I'm not seeing any more questions or hands raised. So we are going to conclude the webinar. And again, we thank everyone for being on, and the door is still open for feedback. Preferably if you can get that feedback to us by this Friday, that would be fantastic. And you will be hearing updates from us over the next few months about the timing of those advisory committee meetings. So everyone, stay well, take care of yourselves, and we look forward to talking with you in the spring.